Hello everyone. Today we'll be studying one important topic from pediatric nursing, that is growth and development. And here I am referring PR YADAV Comprehensive Book Volume 1 and 4th edition. Please hear me out and hope all the concept regarding growth and development will be cleared. So let's start. Okay. So what is growth? We all know that increase in size or mass of tissue or body parts and whole body by multiplication of cells. Fine. Here what happens? That size of the cell or mass of the tissue or any body parts and whole body by multiplication of cells, it increases. Okay. So here growth in length measured in centimeter, meter and inch, and growth in weight measures in kg or pound. Okay, hope it is clear. Now coming to development part. What is development? That is qualitative change of the body. Physiological and functional maturation. It is related to myelination of nervous system. What does that mean? Means when we are child, that time our mental development or our nervous system change, that will be different from adult life, right? So we have developed a lot since childhood, right? So, and still developing. So that is the development. What is the qualitative change of the body? Now coming to the number of cells increases. That is written like a statistics. It is given that is 60 days fetal life 0.2 to 10 to the power 12 cells. At birth the rate is 2 into 10 to the power 12 cells, and in adults 6 into 10 to the power 13 cells. Okay. Now coming intrauterine growth influenced by growth hormone has no role in intrauterine growth. So you have to remember like that growth hormone has no role in intrauterine growth. Okay. Then coming to tissue growth, it occurs by insulin and insulin like growth factor, that is IGF. Okay. And skeletal growth, it occurs by T4 and which is thyroxine, and which secreted from 12 weeks onwards of gestation. So here basically you have to remember that GH has no role. Tissue growth, it occurred by insulin. I am marking. Okay. Insulin and insulin like growth factor IGF-1. So you have to remember this too. And skeletal growth, it is regulated by thyroxine, which secret from 12 weeks onwards of gestation. Okay. Now coming to the extrauterine growth influenced by, that is like after delivery of the baby, right? Extrauterine means what? Fetus is not in uterus. Okay. So that time that will be influenced by growth hormone, thyroxine and steroid at time of puberty. Okay. No role of insulin and IGF-1. In intrauterine life, there was role of insulin and IGF-1, but here in extrauterine life, or in the infant or newborn or neonate, whatever you tell, from that period itself, that growth hormone and thyroxine and steroid, it starts working. Okay. Now coming to the periods of growth and development. Okay. Let's start. What is the first one? That is prenatal period. Okay. What is that? First we will see zygote. What is zygote? We will call it zygote up to 0 to 12 days of fertilization. In that period we will call the conception जो content है उसको zygote बोलते हैं. What is embryo? That will be called 14 days or 2 weeks to 8 weeks. Okay. After that it is fetus, 9 weeks to birth. So let's revise it again. Zygote, it is called 0 to 14 days or 2 weeks, and then embryo, it is 2 weeks to 8 weeks. Rather you can remember like that 2 weeks to, I am writing here. Okay. See. Okay. That is 2 to 8 week. Here we can remember like 0 to 2 week, or 0 to 14 days, then 14 days to 8 weeks and 9 weeks to birth. Then coming to the perinatal period. What is perinatal period? That is 12 weeks of gestation to 7 days of birth according to the WHO. So 22 weeks, or you can say stage of viability, it is called when the baby's gestational period is 22 weeks. Okay, like that you can remember. Then postnatal period, neonates first 4 weeks of life, that is 28 days, it is called neonatal period. We already know if you are having pediatric posting, then also you can see in NICU or PICU the neonate baby. And what is early neonatal period? This one you have to remember, that is first week of life or first 7 days. And late neonate, it's from 7 days to 28 days. Okay, then coming to the infant. Infant is first year of life. What is toddler? Toddler is 1 to 3 years. Preschool is 3 to 6 years. It is also called early childhood. Then school age child, which is 6 to 10 years for girls and 6 to 12 years for boys. That is also called middle childhood. Okay, now adolescence. Generally it is 13 to 18 years. Then it is also classified in 3 stages. So we will see, that is pre-pubescent, late childhood, 10 to 12 years for girls and 12 to 14 years for boys. Pubescent, that is 12 to 14 years, that is for girls, and 14 to 16 years for boys. Post-pubescent, that is 14 to 8 years for girls and 16 to 20 years for boys. So better if you remember only in general condition, that is 13 to 18 years. That is also enough, I guess. Then coming to physical growth. What is that? Normal newborn weight is 2.5 kg or more according to the WHO. Then newborn lost 10% weight of birth weight in first week of extrauterine life due to some problem in adjustment, inadequate feeding, digestive adaptation, and extra loss of cellular fluid. So what does that mean? Okay, let me clear you. When you will go in, मान लो NIC में पोस्टिंग हुआ तो एक मम्मी आई, वो बोल रहे कि मेरे बच्चे को वेट इतना क्यों कम होते जा रहा है, सर आप बोले थे कि, या मैम आप बोले थे कि ये आपको वेट चेक करना है, तो उसका वेट रैपिडली फर्स्ट वीक में बहुत कम होते जाता है. क्योंकि वो बच्चा एडजस्टमेंट के लिए इनएडिक्वेट फीडिंग, ऑब्वियसली कोई मदर का मतलब मान लो 3 दिन तक ब्रेस्ट मिल्क नहीं आ रहा है, तो क्या होगा, यही प्रॉब्लम है ना. तो इसके लिए, एंड डाइजेस्टिव सिस्टम इज ऑल्सो नॉट लाइक वर्क प्रॉपरली एट इनिशियल स्टेज एंड extra loss of cellular fluid. Next, coming to what the weight gain, that is 25 to 30 gram per day weight increase during first 5 to 6 months. So like that you have to remember, that is 25 to 30 gram per day, and for next 6 months that is 15 gram per day weight increase during next 6 to 12 months. Okay, so you can remember like, okay, that is 25 to 30 gram for first 6, sorry, this is months, right? 6 month and 15 gram, इसका half कर दो, 15 gram per day. This is for next 6 month. Okay, like that you have to remember. Then there is a formula, okay, that will also come at later stage. So let's see. This time all these questions also come like when in which age that weight doubles, that is 5 to 6 months, triples in 1 year, 4 times in 2 years, 5 times in 3 years, 10 times in 10 years. Okay, now coming to the body weight estimation formula that I was telling now, that is 3 months to 2 years, it will be age in months plus 9 divided by 2. So मान लो अगर बच्चे का वेट 3 महीना है ना, 3 महीने ही है, सोच लो, तो 3 plus 9 divided by 2, so it will be 6 kg. Fine. Now coming to the 2 years to 6 years, that is age into 2 plus 8. 7 years to 12 years, that is also different formula, age into 7 minus 5 divided by 2. So like that you have to remember, like in exam purpose also, if they ask sometimes like in an odd years and telling you to calculate the weight, then you can apply all these formulas. Now coming to height or length. At birth, full term baby is 45 to 50 centimeter. During first 6 months, height increases 2.5 centimeter per month, and next 6 months it is 1.25 centimeter per month. So how you will remember? For weight we have studied, right? For weight what we have studied, that is 25 to 30 gram, right? 25 to 30 gram. So you just put a dot in between. So 2.5 centimeter will be height. Okay, and in this is for first 6 months, and here you will put 1.25 centimeter per day for next 6 months. Like that you can remember. Okay, I am telling the easy trick. Then 1 year of age, that is 75 centimeter, you have to remember this 50% of increase. Next 2 years it is 85, and in 4 years if you have to remember, that is doubles of birth weight. When it is doubles of birth weight, it is 5 to 6 months, but doubles of birth height, it is in 4 years, and triples of birth weight, it is in 13 years. So basically if in competitive exam they ask all these things, Okay, then height estimation formula, what is that? 2 to 12 years, it is age in years into 6 plus 77 centimeter. Now coming to head circumference. At birth, it is 33 to 35 centimeter and it should be measured after 48 hours of birth because molding may give false measurement. Fine, because मान लो वो जो बच्चे का डिलीवरी के टाइम या वेजिनल डिलीवरी या तो स्पेशली इन वेजिनल डिलीवरी इफ यू नोटिस दैट टाइम दैट मान लो फोर्सेप डिलीवरी हुआ या कुछ एक्सटर्नल रोटेशन इंटरनल रोटेशन बहुत सारी चीज होता है राइट. सो इन दैट केस दैट मोल्डिंग के चक्कर में फॉल्स मेजरमेंट हो सकता है. Then measurement is in 3 months it will be 40 centimeter. In 2 months it will be 45. 2 years it is 48. So what is the rate now? First 3 months it will be 2 centimeter per month. 4 to 6 months it will be 1 centimeter per month. Then 6 to 12 months it will be 0.5 centimeter per month. Like that you have to remember. Now chest circumference. What is that? At birth 30 to 33 centimeter, 3 centimeter less than head circumference. You have to remember. So what is that? In head circumference, what was that? 35, right? And at 1 year of age, head circumference become equal to chest circumference. So you can remember 1 year of age, head circumference become equal to chest circumference. Now coming to the instrument used in measurement. These things also comes in exam. Okay. Length, it is measured by infantometer used in age less than 2 years. They may trick you, right? They will ask like, tell me of how you will measure a baby who is 4 years age, 4 years old, sorry. So what will be that? That will be stadiometer, right? Because after 2 years it will be stadiometer. In next line you can see here height will be called when it is above 2 years of age. So you can write here that in that case it is above, sorry, here it will be below 2 year, here it will be above 2 year. Fine. Now coming to the weight. What is the weight here? Okay, height it will be stadiometer for above 2 year. Now weight measured by electronic weighing scale, that is in hospital practice, and Salter scale in field practice. Now testis size it is measured by orchidometer. In case of मान लो premature baby है तो उसके लिए या टर्म बेबी के लिए कुछ अगर एबनॉर्मलिटी दिख रहा है तो वो सब कैसे टेस्ट करेंगे या कैसे मेजर करेंगे, उसके लिए वो है ऑर्किडोमीटर. नाउ स्किन फोल्ड थिकनेस मेजर बाय हार्पिंटन कैलिपर्स. मेनी टाइम्स दे आस्क इन क्वेश्चन. Okay. Now body proportion. Ratio of upper segment or lower segment of body measured by symphysis pubis. Pubis somewhere here. Okay. So this will be upper segment. This will be lower segment. Upper segment and this is lower segment. Fine. So in that at birth it will be 1.7:1. 3 years it is 1:3, sorry 1.3:1. Then puberty at 10 to 12 year it is 1:1. Now vital signs of newborn, what is that? You have to remember like that. And age wise also vital signs is very important from exam aspects. Temperature it is 96.8 to 99.0 degree Fahrenheit, that is 36 to 37.2 degrees centigrade. Respiration it is 30 to 60, average is 40 beats per minute. Pulse rate it is apical, what will be that? 120 to 160 beats per minute. Here it is beats per minute. Okay, here it is beats per minute. BP will be 80 to 40 mmHg. Now coming to the basic principles of growth and development. What are they? Now see, growth and development is a continuous and orderly process. Okay, growth and development occur in cephalocaudal, that is direction of head, arm, neck and legs. So again if you are drawing a diagram like मान लो, so like this it will be cephalocaudal. And what is proximodistal? That is also central to peripheral order. So this is the order you have to remember for the growth and development. Now term used for newborn. So term baby, when it will be called term baby, that is 37 to 42 weeks of gestational age. Okay. Now preterm baby, neonate born before 37 weeks prematurity. Postterm baby, that is born after 42 weeks. Then low birth weight below 2.5 kg, very low birth weight, that is less than 1.5 kg, and extremely low birth weight baby, that will be called when birth weight is less than 1 kg. So this all are very important, you have to remember. So quick revision: term baby when it is 37 to 42 weeks of period of delivery. Then preterm baby before 37 weeks. Post-term baby after 42 weeks. Low birth weight baby, that is less than 2.5 kg. Very low birth weight baby when it is 1.5 kg से नीचे है. Extremely low birth weight, that will be less than 1 kg. Okay. Now coming to the next point. So initial care of newborn, you can see suction. First oropharynx, then nasopharynx. So AIM, like that we have remembered like that. AIM comes before N, like that. So first mouth, then nose, like that you can remember. Then keep suction pressure, that is 80 mm Hg to 100 mm Hg. Then dry up the newborn and stimulate crying by rubbing the back. Then keep head in low position, modify Trendelenburg position, and immediately after delivery to extract the mucus. Okay, so we have to put the baby's head low position so that mucus ताकि उसको choking ना हो जाए, right? To prevent choking, we are giving this position to the baby. Then rooming in. What is rooming in? Rooming in is keep the infant in the same hospital room along with the mother immediately after birth. That is called rooming in. First period of 24 hours of life called period of reactivity. What is period of reactivity? Then it is called first period of 24 hours of life. So in that period, what baby will do? The first period of reactivity begins with birth and lasts approximately 30 minutes and ends when the infant falls into deep sleep. Okay, मतलब बच्चे का first sleep period. Okay, then common assessment finding include transient tachypnea, nasal flaring, sternal retraction, crackles, tachycardia, and irregular heart rhythm. All these things we have to assess in that sleeping baby. Okay, thus in the second period of reactivity begins when the infant awakens from fast sleep and usually lasts 4 to 6 hours. Okay, बच्चा सो गया. ओके, देन उसके बाद सेकेंड पीरियड कब होगा? जब बच्चा उठ जाएगा नींद से. Infant awakens from fast sleep and usually lasts for 4 to 6 hours. Then common assessment finding include signs of excessive respiratory and gastric mucus, hunger, apneic episodes, and the passing of meconium. In that case, when the baby will pass meconium, that is within first 24 hours. Okay. Then birthmarks. These are the common birthmarks that will be seen in baby. That is telangiectatic nevy or stork bites. What is called that? Red or pink dilated capillaries on eyelid, nose or on the nape of the neck, which blanch more easily and more prominent during crying. Okay, disappear at 2 years of age. Nevus flammeus, what is pore to wine stain. Okay, a large non-elevated reddish purple discoloration of the face or neck and may require future surgery. Okay, then nevus vasculosus, strawberry mark. That is capillary hemangioma, enlargement of superficial blood vessel mainly of head, disappear by age of 7 to 9 years. Okay, Mongolian spot, what is that? That is, we have seen this mark, that is bluish black pigmentation on lumbar area and buttocks, gradually disappears during 1 to 2 years, it will disappear. Then Harlequin sign, deep pink or red color over one side of newborn's body and while the other remain pale or normal color. This sign may indicate shunting of blood with cardiac problem or sepsis. Mainly this is the abnormality. If baby is having any cardiac problem, we can find out by Harlequin sign. Like मान लो एक साइड जो है ना, मान लो बच्चे का एक साइड नॉर्मल कलर है, ठीक है, and another side it will be different color. Fine. So this is the Harlequin sign. Basically this is the Harlequin sign. Now coming to the next page, that is changes during first week of neonates. That is 5 to 10% weight loss during first week, which regained by 10 to 14 days after birth. I am using different color. That is 5 to 10% weight loss during first week, which regained by 10 to 14 days after birth. Then lanugo, what is called lanugo? Then fine downy hair on the body of fetus starts to disappear slowly, starting from face. Then neonatal mastitis, that is swelling in breast of both sex, both boys and girls, and secretion of white viscid can be start to express second and third days onward, which is called witch milk. It occurs due to presence of maternal steroid hormone into the newborn. Okay, it is called witch milk. Then meconium, green black color for stool, and urine should pass within 24 hours of birth. I already told you that meconium should pass within 24 hours of birth. Then umbilical cord dry at 5th days and start to fall at 7th day by aseptic gangrenous process. Okay, hope all these points are clear to all of you, and see you in next video. Thank you.